This video is sponsored by Bootcamp.com. Check it out for INBDE prep and use coupon code MENTALDENTAL for 10% off. Hey everyone, Dr. Ryan here, and welcome back to our dental anatomy series. This is the practice questions video, so we will be testing everything that you've learned up until this point. So this is everything that we went over in the dental anatomy series. We covered terminology, all of the individual teeth, and then we ended talking about occlusion, how those teeth function together. If you haven't already, I highly recommend watching all of these videos. It'll take a few hours, but it'll be so worth it to get a full overview of dental anatomy. And I broke down the material covered on the board exam into those 18 videos of high-yield information. And that information will really help you when it comes time for you to take the test. So we have 15 practice questions here for us to go through together, and these will be very similar to what you'll see on test day. So keep track of how you do, and let me know in the comments how many you got correct. All right, so with that, let's get started with question number 1. Question number 1, which incisor is most likely to have a lingual pit, a developmental flaw where enamel invaginates? Go ahead and pause the video, think through the question, and then we'll go over it together. All right, so first let's look at the answer choices. We have all 4 incisors as possible answers. If we talk about the mandibular incisors first, you might remember that the lingual surfaces of those mandibular incisors are very flat and very boring. So it's unlikely that there's some kind of anatomical flaw that's going to occur in those teeth. That leaves us with either the maxillary central or the lateral incisor. Well, you may recall that the maxillary lateral has the most prominent marginal ridges of all anterior teeth and the most distinct and deepest lingual fossa of all anterior teeth. All of that together sets this tooth up to be the most likely to have a lingual pit anomaly, in addition to a host of other possible anomalies. We had a whole slide dedicated to the weird things that can happen to the maxillary lateral incisor. So the answer to that question is B. And here were our examples of lingual pits. Question number 2. What is the most likely non-molar tooth to develop from 5 developmental lobes? Go ahead and pause the video, think through the question, and then we'll go over it together. When it comes down to the developmental lobes, almost every tooth in the mouth originates from 4 of them. There are only a few exceptions to that rule. A 3-cusped molar will have 3 lobes, like the heart-shaped maxillary second and third molars. A 5-cusped molar will have 5 lobes, that's the mandibular first molars and maxillary first molars with like a really big cusp of Carabelli. And finally, 3-cusped premolars will have 5 developmental lobes as well. And the only 3-cusped premolar that we know of is the Y-type mandibular second premolar. So the answer to this question is E. And here I've circled approximately where each of those 5 developmental lobes contributes in terms of the final tooth structure. Question number 3. In an ideal angle class 1 occlusion, what cusp contacts the mesial marginal ridge of tooth number 13? Go ahead and pause the video and then we'll talk about this question together. So this is a classic occlusal contact question. And ideal angle class 1 just means a normal bite, a normal fitting occlusion. So this would be a great time to practice drawing out the picket fence if you haven't already done so. But even before we look at the picket fence, we can actually eliminate 3 of these 5 answer choices immediately. So we can rule out B and D right away because they are non-functioning cusps. Remember the Bull rule, buccal upper and lingual lower. The Bull rule describes cusps that should never be in contact. So these are both lingual cusps of lower teeth. So they should never be in contact with anything. We can also rule out E because it doesn't follow our rule where teeth that touch add up to 33 plus or minus 1. 13 plus 22 is equal to 35, which is not between 32 and 34. So we can rule that out as well, and we're left with A or C, both of which are functioning cusps. They're both facial cusps of lower teeth. So now we need to look at our fence. Now, number 13 is a maxillary second premolar. So we find P2, we go to the mesial marginal ridge of that tooth, and then see that the facial cusp of the mandibular second premolar, which would be number 20, is contacting it. So the answer to this question is C. We can double check 13 plus 20 is equal to 33, which falls between that 32 and 34 range. Now, if this question said distal marginal ridge of tooth number 13, then the answer would have been A, where the mesiofacial cusp of tooth number 19 would be contacting the distal marginal ridge of that tooth. Question number 4. The oblique ridge of the maxillary first molar travels between which two cusps? Go ahead and pause the video and then we'll talk about this question together. So remember, from the occlusal view, the maxillary first molar is like this rhombus shape where it's pointing toward the mesial, and the oblique ridge runs diagonally to split that rhombus in half, into two halves, we'll say. And one of those halves is called the primary cusp triangle, that pizza slice analogy I used, which includes the mesiofacial, mesiolingual, and distofacial cusps. So you know the answer has to include 2 out of those 3. So we can already eliminate C and D because those answers include the distolingual cusp. So we're left with either A or B. And if you had to guess without even drawing anything, you'd think 2 mesial cusps are going to be making kind of a vertical line. And in fact, a line connecting those 2 cusps describes the mesial marginal ridge. Whereas distofacial to mesiolingual is diagonally across the tooth surface. And that's exactly what we're looking for. So the answer to this question is A. The oblique ridge travels from the distofacial to the mesiolingual cusps. Question number 5. What is the most likely anterior tooth to have a bifurcated root? Go ahead and pause the video and then we'll go over this together. So let's start by talking about the maxillary central, maxillary lateral, and just for kicks, the maxillary canine, although that's not included as an answer. 100% of the time, those 3 teeth will have 1 root and 1 pulp canal to go along with it. So we know it's not going to be A or B. Those are not going to be the most likely bifurcated. Remember, the mandibular central is the most boring tooth in the mouth, so it's unlikely that that's going to have something weird like a bifurcated root going on. So we can rule that one out as well. The mandibular lateral incisor is a really good guess because it's the most likely of all these teeth to have 2 pulp canals, but not 2 roots. Remember, just because something has 2 pulp canals does not mean it has 2 separate roots. The mandibular canine does have a very deep distal root flute, and therefore it's the most likely anterior tooth to have a bifurcation. So the answer to this question is E, and this is the x-ray that I had shown in the video covering the mandibular canine. Question number 6. The prevalence of cervical enamel projection is highest in which of the following? So go ahead and pause the video and then we'll go over this together. So a cervical enamel projection refers to a tooth anomaly where there's a flat triangular extension of enamel apically beyond the normal cervical enamel junction into the furcation area of a tooth. And it turns out this anomaly is most likely to appear in the mandibular second molars. This is just one of those high-yield facts that you need to remember. So the answer to this question is D. And this is a picture from the video on mandibular second molars showing you the dipping down of enamel into the furcation area, which is otherwise known as a cervical enamel projection. Question number 7. Where does the incisal edge fall relative to the long axis for mandibular incisors? Go ahead and pause the video and then we'll go over this together. So this is a great opportunity to review where incisal edges fall for different teeth. So remember, the maxillary canine cusp tips fall facial to the long axis. The maxillary incisal edges usually fall on the long axis of the tooth, and all mandibular anterior teeth, incisal edges and canine cusp tips, fall lingual to the long axis of the tooth. So since we're asking about a mandibular incisor, the answer to this question is C. The incisal edge falls lingual relative to the long axis of the tooth. Question number 8. The overall crown shape of a mandibular molar from the side view is best described as a what? Go ahead and pause the video, think through the question, and we'll go over it together. So all maxillary posterior crowns from the side view are trapezoidal, so they kind of narrow as you go towards the occlusal surface, while all mandibular posterior crowns from the side view are rhomboid or parallelogram shaped, and they're skewed or tipped toward the lingual direction. So the answer to this question is B. And here is a side view picture of the mandibular first molar to give you an idea of what that rhombus or parallelogram shape looks like. Question number 9. In what maxillary molar is the distolingual cusp largest? Go ahead and pause the video and then we'll go over this together. So this question tests your knowledge of the general patterns and trends that we've mentioned throughout the series. Besides the cusp of Carabelli, and sometimes the distofacial cusp as well, the distolingual cusp is the next smallest cusp for all of the maxillary molars. But there is an important trend concerning the distolingual cusp, and that is, as we go distally or posteriorly from first molar to second molar to third molar, that distolingual cusp shrinks. And sometimes we can get that heart-shaped molar or three-cusp molar where the distolingual cusp isn't even there. So the distolingual cusp is largest in the maxillary first molar and smallest in the third molar. So the answer to this question is A. Question number 10. On what side is the root trunk longest on the maxillary first molar? Go ahead and pause the video, think through the question, and then we'll go over it together. So here we have another trend question, and it must have been a coincidence when I was writing these questions. And remember, the root trunk is the area from the CEJ to the furcation. Generally speaking, as you go distally or posteriorly, crowns get shorter and root trunks therefore get longer. So the root trunk will get longer as you go from mesial to facial or lingual and finally to distal. So the answer to this question is D. And here's the image I showed in the video series depicting that trend. Question number 11. Which teeth in the mouth are normally wider mesiodistally than facial-lingually? Go ahead, pause the video, think through the question, and then we'll go over it together. So I like this question because it incorporates many different videos from the series and gives you an opportunity to synthesize all of that information together. So keep in mind the occlusal view of all these different teeth as we go through the answer choices. And we're going to start from the bottom and work our way to the top. So the mandibular molars clearly are larger or wider mesiodistally than facial-lingually. It's either a wide pentagon or rectangle shape. In fact, mandibular first molars are the widest teeth, mesiodistally, in the entire mouth. Maxillary molars, though, are a different story. So they're wider facial-lingually than mesiodistally. They're kind of like a stretched out rhombus from the occlusal view, so we can eliminate D from the answer choices. Now for maxillary incisors, their incisocervical dimension is their largest dimension, but we don't care about how tall these teeth are for this particular question. They're in fact wider mesiodistally than they are facial-lingually, so that part is good. We like that part. The problem with this answer choice comes with the mandibular canines, and both maxillary and mandibular canines are wider facial-lingually than they are mesiodistally, and that's because of the relatively large cingulum that these teeth have. So we can eliminate this answer choice as well because of the canine inclusion. And then for answer choice B, all of the premolars are wider facial-lingually than they are mesiodistally because they have a facial and a lingual cusp, or sometimes lingual cusps, that stretch the tooth in the facial-lingual dimension. The mandibular first premolar is the closest that we have to being circle-shaped, but even that tooth is wider facial-lingually than mesiodistally. So that leaves A, and we've already talked about maxillary incisors and mandibular molars. Those both are good, so that is the correct answer. And here you can see why those teeth fit this description well. Question number 12. Which of the following posterior teeth is most likely present with just one pulp horn? Go ahead and pause the video, think through the question, and then we'll go over it together. So you may have noticed that all of the premolars are included as answer choices, and one of them is not quite like the other. There's an outlier here when it comes to pulp horns, and by extension, cusp tips. So let's go through them. Both maxillary premolars usually have two cusps and therefore two pulp horns, so we can pretty safely rule those out from a possible answer. The mandibular second premolar usually has two or even three cusps and therefore two or three pulp horns, so we can definitely rule that one out. But the mandibular first premolar has that really short lingual cusp, and that cusp can be so small that it doesn't even carry a pulp horn with it. And then what we're left with is only one pulp horn that comes from the facial cusp tip. So the answer to this question is C. Question number 13. Which of the following is a manifestation of dens evaginatus on a maxillary lateral incisor? Go ahead and pause the video, think through the question, and then we'll go over it together. So if I look at the answer choices, I see something that I would consider a classic trick answer, and that's dens indente. So this is also called dens invaginatus, not evaginatus. So that's a tricky answer choice, but it's not the correct one. Pericymata are the little ridges at the cervical third of teeth, usually in the anterior. The palato-gingival groove is this anomalous groove that travels from the lingual fossa into the root surface. And the talon cusp is a manifestation of dens evaginatus on an anterior tooth, where there's an extra cusp on the lingual surface where the cingulum is. So the answer to this question is B. And here were our examples of talon cusps, again on maxillary lateral incisors. Question number 14. What is the only tooth in the mouth that routinely has two distinct grooves on its facial surface? Go ahead and pause the video and then we'll answer it together. So all of these teeth in the answer choices normally have one facial groove down the center of the tooth except for one. Another way to think of this is there's going to be one facial groove between a mesiofacial and distofacial cusp, But if we add in a third facial cusp, then we're going to have a second groove. And thanks to the distal cusp of the mandibular first molar, we typically end up with a subtle distofacial groove in addition to the regular facial groove. The mandibular second molar is tempting, but it does not routinely have a distal cusp, so it does not have a second facial groove. So the answer to this question is C and only C. Okay, the final question of the video. Buckle up for this one. This is a tough one. At the delivery of a new maxillary complete denture, the prosthesis slides to the left when the patient occludes on it. What is the most likely interference? All right, so at first glance, this question probably sounds impossible. You're like, Dr. Ryan, I know the bull rule, I memorized the picket fence and the occlusal grid, and all of those things will certainly help you on the exam big time, trust me. But here, we need something else from the working movement video. Go ahead and pause the video if you want to work through this question first. Otherwise, we're going to pull up a resource that will really help you answer this question. So here's our working movement image from the coronal view, and in this specific picture, the mandible is moving to the left, and remember how we also talked about the maxilla being stationary during this movement. Well, that's true unless you have a denture, or I should say a poorly fitting denture, like in this case. So if the maxillary denture is sliding around, obviously that shouldn't be happening, and it suggests it's loose and/or there's some occlusal interference going on. If the maxillary denture is sliding to the left when the patient is closing down, that means something is pushing against one of these three red lines. Something from the bottom is pushing against one of these three maxillary inclines. It's the only way that this maxillary denture would be sliding specifically to the left. Again, those are the only possible incline contacts that would displace the denture to the left because of those resultant force vectors. So now, all we have to do is find one of those three inclines in the answer choices. So option A says facial incline of maxillary facial cusp. So the facial facing incline of the maxillary facial cusp isn't even contacting anything, so it can't be that answer. Let's go to option B, lingual incline of maxillary facial cusp with mandibular facial cusp. Okay, so that one is talking about this incline. All right, that looks pretty good. We'll put a little mark next to that one. Option C, facial incline of maxillary lingual cusp. Okay, so that's going to be this incline with mandibular lingual cusp. All right, let's be careful. It doesn't look like that's one of the, red lines on the diagram, but if we go over to this side, the facial incline of the maxillary lingual cusp is one of those red lines. But what is it saying it's occluding with? The mandibular lingual cusp. Well, the mandibular lingual cusp, if we're moving to the left, is going this direction. There's no way it can contact with that incline. This would have to say mandibular facial cusp to be included here. So that answer we can rule out as well. And lastly, we have lingual incline of maxillary lingual cusp with mandibular facial cusp. Well, that's this red line, but again, look at the second part of the answer option, facial cusp. Well, it would be correct if it said lingual cusp, but the facial cusp is over here. It's moving to the left. There's no way that's hitting that incline. So we can rule that option out as well. Again, just like option C, the second part of the answer messed everything up. So if I erase all the lines here, we go back to answer B. That is correct. It's the only one that has both the first part and second part accurate. A lingual incline of a maxillary facial cusp with the facial incline of the mandibular facial cusp. This could be multiple teeth interfering, or maybe just one high tooth that's interfering and messing everything up. If that cusp is a little bit too high, the patient bites down and then the denture slides to the left, and that's how you're getting that result. So the answer to this question is B. All right, so that was it. That's all 15 questions. So how'd you do? Let me know in the comments. I want to know how many of the 15 questions you got correct. These questions that we went through are very, very similar to what the board exam will ask. If they felt like they were super challenging, go back and watch the videos, take some more notes. All of the information that these 15 questions tested you on was included in the series in at least one of those videos. So definitely go back and watch if there are specific areas that you feel like you had some blind spots. If these questions felt not that challenging, then that's awesome, because these are some pretty tricky and detailed questions. And so if you did really well, that's a great sign that you have mastered this topic. So thank you so much for watching this video, everyone. I appreciate you sticking through with me on this whole series, and I'll be looking forward to the next series. Until that time, take care, and we'll see you in the next video series. That's it for this video. Thank you so much for watching. Please like this video if you enjoyed it, and subscribe to this channel for much more on dentistry. If you'd like to support me, please check out my Patreon page. And thank you to all of my patrons for their support. You can unlock access to my video slides to take notes on and practice questions for the board exams, so go check that out. The link is in the description. Thanks again for watching, everyone. I'll see you in the next video.